Well, good morning and Happy New Year to everyone coming back from hopefully a restful holiday break. We're so happy to have you here, and we're joined by Doctors Hospital at Renaissance, and today's topic is going to be rehabilitation. So I wanted you to know that we are recording this. I'm very excited for those of you who watch this at a later time. That's the point of cyber mentoring, whether you're watching it live or recording, that you're getting some great information. I'm going to turn it over to Bernadette Perez. So Bernadette, this is yours.
Hi, I'm Bernadette Bettis. I'm a project coordinator here at DHR in the education department. I'm going to introduce you to Mike Auer. He is a DPT director at Rehab Hospital. We're going to hear a little bit about his background, how he got into the healthcare field, and also about Rehab Hospital. So let's get started.
Good morning. Like Bernadette said, my name is Michael Auer. I'm a doctor of physical therapy and director of therapy services here at Doctors Hospital Renaissance. I have a list of questions, so I can start off with there, but if anybody has any questions, please feel free to ask away.
Thank you for saying that. I want to remind the classes that are watching that there's a chat feature, and if you have a question, you can just type it into the chat feature and I'll relay it. Thank you.
I think that's a max.
Great. A little bit about my journey, I guess. I'm a doctor of physical therapy. I've been a therapist for about 17 years. I would say I took the long route to become a doctor of physical therapy, and the reason I say that is because I started as a physical therapy assistant, which is an associate degree, but we're also licensed. So one place in the Rio Grande Valley where you can do that would be at STC. They have a physical therapy assistant program. It was the difference between physical therapy assistant and physical therapist is that therapist assistants can do all the treatments, but we cannot set goals and we can't change the plan of care, and we do not do evaluations. That is all specifically, zoned for the evaluating therapist, whether it be occupational, physical, or speech. That's a 2-year program. When I was a therapy assistant, I'm originally from San Antonio, Texas. So I worked at rehabs in San Antonio and Houston, Memorial Hermann Tier, University Hospital, Level 1 Trauma, Health South Riosa, Rehab Institute of San Antonio, and a little bit of work at the Center for the Intrepid at Brooke Army Medical Center. I was here when DHR opened the rehab back in 2005, 2006, and I was a physical therapy assistant at that time. I went back for my doctorate in 2008 and completed in 2011. In 2016, they opened up the role of therapy director, which never existed until 2016. And I'm happy to say that I was a part of all the growth, contributing to the growth that has happened since 2016, which I'll talk about in a little bit. My decision to pursue a therapy role originated from my father. I guess he's every therapist has a story. Usually it's linked to some sort of injury they sustained in athletics or sports, but mine was due to my father's car accident that he had when he was about 18 years old. He's a T10, thoracic 10, spinal cord complete, which means that he's paralyzed from the belly button down, and he's been so since he was about 18. I came along after his injury. So those of you that might not know, it is possible to have children after a spinal cord injury. My father's a living proof of that, so am I. And so growing up, I always saw him he was very independent, and he drove a car, went to work, had hobbies, still liked to work on cars. And so I asked him one day when I was about 7, I said, how did you learn to do all these things without the use of your legs? I thought it was amazing. And he said, my therapist taught me. So I knew about since the age of 7 that this is what I wanted to do. he was a big inspiration to me doing what I do. The field of physical therapy is very broad. And so I decided to specialize in what we call inpatient rehab. Inpatient rehab is aggressive rehab after an acute injury, usually a severe injury such as a traumatic brain injury, a spinal cord, a stroke, usually something neurological or traumatic like a car accident or something of that nature. I've done that for the majority of my career over the 17 years, and that's what I'm primarily the director over here at DHR. So that being said, I also specialize in patients with neurological injuries, traumatic brain injury, stroke, and spinal cord. Any questions so far? I heard the thing going off a little bit.
No, not yet.
Okay. So inpatient rehab is an exciting thing to me. It's my love. I've done a little bit of outpatient. I've done acute. I've done a very brief stay in home health. Home health definitely not for me. Not that it's a bad thing, but everybody has their calling to what setting. But before I start going into rehab, the scope for practice for PT is broad. So you can do pediatrics, geriatrics, sports, ortho, regular ortho, outpatient, nursing home, which is skilled nursing facility, LTAC. The specific specialties that are out there would be lymphedema, women's health, pelvic floor, wound care. The scope of practice of physical therapy is pretty broad. Pulmonary rehab, cardiac. I don't just want to talk about PT. There's also occupational therapy and speech that have similar specialties in reference to the setting, which is primarily acute, inpatient rehab, outpatient, skilled nursing facility, and LTACs and home health. The profession is very rewarding. In reference to rehab, we see patients on an average that stay here from about 14 days to about 18 days, and the rehabilitation is very intense. It's very aggressive. They have to do at least 3 hours of therapy a day. So oftentimes we see patients that come in here that can't sit up, they can't walk, they can't talk, they can barely move, and a lot of the times they're able to walk by the time they leave with assistance. And so that in itself, if you want a profession where you're going to see that type of change in a short amount of time, is extremely rewarding, and to have that interaction with the family, dealing with a very vulnerable state, these families are shaken up. They're scared. They don't know what to do or what to expect. And therapists, we kind of put on many hats. Not only are we the people prescribing the exercise, the rehabilitation, but we're also, listeners. We have to, give guidance to the families on how to deal with these situations. We have to be advocates to make sure that the specialties that need to be involved in their care, that we tell the physicians that we involve maybe neuropsych or some sort of counseling services, because some of these experiences are very dramatic, and depression is very prevalent. And so, but it's very rewarding when you see that, 18-year-old from a car accident, or that, 75-year-old that fell down, be able to go back home and sometimes be a productive member of society, or just be able to go home and be with their family. That, that's very rewarding. So that's the kind of the stuff that we do here at Rehab. The team approach is what we thrive on. So collaboration between nursing, PT, OT, speech, physicians, respiratory, counselors, psych, that is our foundation, and that is our strength as a setting. The communication is fluid. It's supposed to be fluid, and it goes across constantly through team conferences, daily rounding, to optimize the progress of each patient. That's what we pretty much do in a nutshell. The exciting stuff that we do is all the technology that's coming out right now for rehabilitation and therapy. This is a very exciting time for us. An example of that is the robotics that we use. We have 2 robotic exoskeletons that I can show you a poster of in a little bit. But these are robotic skeletons that actually help people walk. They're FDA approved for stroke and spinal cord, but we've been using them off-label use for patients with multiple sclerosis and Guillain-Barré as well. And so I can get a patient up much sooner than if I was to do it just me and maybe another therapist in the parallel bars. I can get them up within days of their admission by the push of a button. I can sit them in the device, attach it to them. I push a button, it'll bring them up to stand without them doing anything. This is very exciting for patients and their families, and the progress, it accelerates the progress much faster. That's very exciting. A lot of different types of devices that we have. Robotics is big. Virtual reality is coming in a big way into what we do. So it's very exciting. Any questions so far?
Yes, before you move on to the exoskeleton and some of the services at Doctors Hospital, I do have a question. I'm very interested in your educational progress from physical therapy assistant and even high school, what you did in high school through your doctoral program, because I think most students don't understand stackable credits. That's what we call it in education, where you can do a certain amount of schooling shorter than what they may imagine and get one credential and then work and start working and then work on your next credential and start and keep working. And well, what we like to say is you level up through the program. So if you could tell us a little bit about your background from high school to your doctoral program.
Sure, absolutely.
Thank you.
My background is, I went to school in San Antonio. I grew up there. I went to a private school, college preparatory school in San Antonio called Central Catholic. It's an all-boy high school in San Antonio. It's the only all-boys school left in San Antonio. But great education. We had 100% graduation, but it was college preparatory. That being said, the amount that high school had prepared me for college is a plus, but even back then when I went to high school, I wasn't getting college credit. These days, high school kids are getting college credit from any public school. It doesn't have to be private. So I think that's a plus for you guys. Y'all can get a lot of your basics out of the way and accelerate these certifications that the professor was talking about in reference to the physical therapy assistant. It takes about a year to get all your prerequisites to apply for physical therapy assistant program, or even occupational therapy assistant program. It takes about a year and a half. Depends on how many courses you want to take, but that is now shortened if you get those basics out of the way in high school. So like your college algebras, your Englishes, your histories, things like that, if you can get those out of the way, that's extremely helpful. But for me, I went through my high school career. I went to St. Mary's University in San Antonio. I majored in philosophy. Also, my family was highly pressuring me to be a lawyer, and so I pleased them, and then I still wanted to do therapy. But by that time, I was already out for 4 years, and I still want to do therapy, so I just wanted to get started. So I went with the therapy assistant route. I applied, got in. It's very competitive. Then it's even more competitive now to get into a physical therapy assistant school now. Even here at STC, very competitive. And so I applied, I got in the first round and started my career. My first job was in Houston, Texas, and I went to go work at an LTAC, which is long-term acute facility. Older population, but I did weekends at Memorial Hermann TIR, which stands for Texas Institute of Rehabilitation and Research. That's one of the top rehab hospitals in the nation. So I started got my foot in the door as contract, and they liked the way I worked, and so they offered me a full-time position. And that's where I discovered my love for rehab in its essence, working at that facility. It's #1 in Texas, and it's Used to be number 2 in the nation. Now it's number 3, but it goes back and forth. And so that's where I got my love for the setting. I made sure to have access to a mentor as a new grad. You can get a job anywhere. You can go after the pay right away. But if you want your career to develop, if you want it to optimize your self-satisfaction, getting into finding the setting that you want and getting mentorship so you can truly become good at what you do is essential. And so my advice is, don't go straight after the money out of school. Go for mentorship out of the school. Look for a job that's going to help develop you as a clinician. That investment of time is worth more than the money on the front end, because as you develop yourself as a clinician, you're going to be more marketable in the future than if you just went after the money and you didn't develop any skills, you know. So mentorship is crucial, and I was very fortunate to have strong mentorship at TIER, and even when I came to San Antonio. Came back to San Antonio, worked at San Antonio, and then I met my wife there, who was an occupational therapist who's from the Valley. So that's how I got to the Valley. And so when she finished OT school, we came to the Valley, and that's how I eventually came on with DHR. Working, constantly developing, I kind of maxed myself out as what I could do as a therapy assistant. And it was time for me to, to move forward with my education. And I decided to start taking prerequisites for my doctorate. So now you need to have a bachelor's before you apply to your doctorate school in PT, OT, or speech. OT is a master's level, occupational therapy is a master's level degree, but it's going to doctorate. It's in the process of going to a doctorate. PT, there's nothing for physical therapists, there's nothing less than a doctorate level. Speech is a master's level, but it's going to a doctorate level as well. All of those, you have to have your bachelor's. Aside from your bachelor's may or may not include some of the prerequisites that is essential for applying to the program. So for PT, your sciences is huge: anatomy 1, anatomy 2, bio 1, bio 2, chem 1, chem 2, physics 1, 2. They encourage an upper level physiology course, and then of course all your basics. To be competitive in applying to these programs, you have to have at least a 3.5, and even then that's kind of, you're right there. You're not competitive. You're not extremely highly competitive with a 3.5. You're going to be going up against some people that are 3.8 GPAs, 4.0s. So 3.5, there has been people that have gotten into PT school with 3.5s, but if you want to remain highly competitive, 3.8 to 4.0 is where you want to strive for. Just to give you some perspective, for PT at University of Texas Health Science Center in San Antonio, which is where I went, the doctorate program, they get about 700 applicants each year. And so out of those applicants, maybe 300 of them are complete, which means that their application is entirely complete, which, and if they're not complete, they're not going to tell you. They're just going to throw it away. You have to complete your applications properly. And so I highly recommend that you go to wherever you're applying and get in contact with an admissions advisor, and they will walk you through on what you need to do, what your GPA needs to be, if you need to retake a class. And a lot of these programs, you need to take a test like the GRE. So they will guide you through that. So I highly recommend you get in touch with an advisor from whatever university you're looking at. And different universities have different criteria. So if you want to go to University of Texas Health Science Center or UTMB or Texas Women's, you have to get in touch with all those advisors because they have different criteria a lot of the times. So that's the academic portion in applying to these programs. Besides that, they're going to look at how did you get back to the community. So doing volunteer hours is huge. So not only into the field of interest, which is required, so doing volunteer hours at a therapy clinic or a hospital in your field of interest is required, but they're also going to look at what did you do for your community? Did you do some volunteer things with your church or at the community pantry or Goodwill, or there's programs here in the Valley like Capable Kids is a huge one, which is it's a organization that helps children with disabilities be able to participate in sporting events, which which before they weren't able to do. So Capable Kids is looking for volunteers to assist with these children, and so that stuff looks really good on your application. But they want to know if you can handle school, if you can handle doing things for your community and your volunteer hours for your profession. They want to know how much you can handle, because once you're in grad school, you're gonna have to keep up with a lot of things, and so that tells them that you're able to multitask. So they're gonna look at things like that. So that's very useful. In reference to the interview, a lot of questions. Some questions that they ask is, define what integrity is. That's a famous question. But they also want to know, do you know about the profession? So do research on your profession, whether it be PT, OT, speech, nursing, doctorate. They want to know what you know about the profession. It would also be beneficial for you to do research about the school and the professors at the school. Know what their areas of interest are, know what their background is, know about the school. You want to look at schools that have a high pass rate on their state board after graduation, first time, and they have those statistics. So my school had a 97% pass rate on their state board the first time after graduation. So that's stuff that you want to look at. Getting back to my journey, so I went through PTA school, started doing my prerequisites for PT school. Sometimes, I knew what was required, so I hired a tutor for my physics classes. Math isn't my strong suit, but I ended up getting an A in those classes because, I planned for it. So if you know that you're weak in a subject, you need to make arrangements so you're successful to be competitive. Completed. When I applied, I only applied to one school, which is University of Texas Health Science Center, San Antonio. That's extremely rare. Most people apply to minimum of 4 schools. There's up to 13 PT schools in Texas. And so I only applied to one and I got in the first time. That was very fortunate, but I would like to say that I prepared properly. Your letters of recommendation do help as well. I had strong letters of recommendation, but some schools don't do interviews. For instance, Texas Women's University, great school, great PT program. Their students are very prepared, but they don't do interviews. They admit their students strictly off what they do academically. So if you're really counting on that interview to kind of push your way into the program, that's a school that's not going to entertain that. So that's in reference to my education. So I finished the program and now I'm here. So the degrees that I possess, I have a bachelor's in philosophy. I have a associate's in physical therapy assistant. I have a bachelor's in allied health and a doctorate in physical therapy. Those are my degrees that I have. Did I answer your question, Professor?
Yes, thank you for sharing, especially the advice that you give. That's something that our students really want to know is, what are the additional beyond academics that I can do to be a good candidate for some of these competitive programs? So thank you.
Yeah, I would like to add one of my first day in my doctorate grad school, doctorate of physical therapy. I had a professor. Her name's Dr. Newstead, Dr. Ann Newstead, who's originally from New York, went to a very prevalent PT school in Birmingham, Alabama, and she later went on to become one of my biggest mentors. She specialized in neurological disorders as well, but I'll never forget what she said one of the first days of school. She goes, thank you, welcome to grad school. I'd just like to tell you that there is such a thing as a dumb question, so think before you ask questions. I am not here to baby you. Welcome to grad school. So when you get into grad school, you've already went through undergrad. They will not tell you that you're missing an assignment. They will not tell you that, they will not seek you out. You have to seek them out. And even when you seek them out, if you're asking questions to be fed an answer, don't be frustrated when they answer your question with a question, because they're trying to promote your problem-solving skills. And so the way that they're expecting you to learn information is not to memorize it. So if you think you're going to study the night before the test, you're going to be very disappointed in your score, because their tests are not geared to support you studying the night before. They're going to be asking you questions that are very similar to the boards, that is going to expect you to synthesize the information that you learn. For instance, you'll have a question that you're going to see 2 right answers that are available, but they want you to choose the most right answer. And that can be very confusing to, say, an unprepared or a very a novice student, should I say. So they really expect you to dive into the information that you're learning. So synthesizing the information is being able to learn the information and to apply it to different scenarios. And so that's what they really promote. And so there's some of their tests, they had sometimes 6 multiple choice answers. So there's A, B, C, D, or is it all of the above, or is it A and B except for, is it all of the above except for C? Is it A and B? I mean, they really ask these questions, so they want you to expect to know the answers. Not to mention that there's written parts of the exam too. So it's all doable. I did it. It's just that you have to put the time in. Yeah. And so that's not to scare you, it's to prepare you. Like I said, this professor, this tough professor, went on to become my mentor, and it's, I thank her every day for being that tough, because it enabled me to be where I am right now, director of therapy at Doctors Hospital Renaissance.
That's great.
Any other questions right now?
No, not right now.
Okay, so a little bit about the exciting things that we're doing here at DHR Health Rehab Hospital is that we're CARF accredited, which means that we specialize in rehabilitation. So we're the only facility in South Texas that has a CARF accreditation. You do not have to have a CARF accreditation to have a rehab hospital, but that just means that that exemplifies that we're able to go that extra mile in being committed to be one of the top performing rehab hospitals. We are also one of the only facilities that has, we are the only facility that has robotics in the Rio Grande Valley. So nobody has robotic exoskeletons south of San Antonio and Houston, all the way up to the whole border, all the way up to Laredo and El Paso. Nobody has robotics, but DHR does. We have 2 robotic exoskeletons. The brand would be EXO GT, that's EKSO GT. Technologies out of Berkeley, California, from the University of Berkeley. So these robots are American made, and they've done tremendous things for our patients. Like I was describing earlier, they can help a patient come from a sitting position to stand without the patient doing anything. If I push a button, it'll move one of their legs entirely for them. If I push another button, it'll move their other leg entirely for them. I can put it in a mode that allow the patient to do as much as they can on their own, and whatever they cannot do, the robot is smart enough to do the rest for them. I can put it in a different mode where it lets the patient do as much as they can on their own, but then I can program resistance into the robot. That way the patient has to push through the resistance as they're advancing their lower extremity. That way we can challenge them across the continuum of their progress. It has a computer that stores all the data into a cloud. And that way I can track how many steps they take, how many minutes they were in the device, how many minutes they were active in the device, and which modes they were in. I can track all that data in this device. And so we're we're not only moving from providing good therapy using high technology equipment, but now we're moving into the data world, which I think a lot of this generation that's coming out of high school into college is going to be very strong at, because they're very strong in IT and technology. And so when I say data, learning how to take what we do with them and be able to track it and make meaningful findings with the data. That way we can justify and what we are doing is the best, and that way we can continue to improve and evolve into better methods in treating patients. And so this device helps us do that. So EXO has been a huge thing for us. If you want to see what EXO does, you can Google it. You can look on YouTube. We have some videos of our own patients on YouTube. We recently had a patient of ours. Some of you might know them. I don't know if there's any students from Nikki Rowe there, but a coach that coaches there now had a severe stroke and came to us. We did rehabilitation on him, and now he's back at work. He's coaching. He's driving. But it was a long journey for him. But our rehab center helped, our outpatient clinic helped, and EXO GT helped as well. So I'm talking about Coach Manny Garcia, soccer coach, and so his journey is really impressive, very inspiring. And he was recently featured. You can go Google on People magazine in Espanol, and so his story was actually featured nationally in the People magazine in Espanol. So, if you're interested, you might want to check that out. And there's a video there too about his progress and things of that nature. And he explains what his journey was. So that's a little bit about that. Any other questions?
No, not yet.
I'm not sure what else to talk about. We have multiple support groups here: amputee, stroke, Parkinson's, ALS, spinal cord. We constantly, after you graduate school with your degrees and you get your licenses, it is up to you to continue to upkeep your license. So you might want to continue to specialize. And so we host certification courses for specialties here. We posted 2 of them, which is 2 4-week courses for neurological certifications. I want to say probably my rehab staff is 21 of licensed therapists, and probably about 85% of them have some sort of specialty certification. So my job as a director is to remove barriers so they can continue to evolve as clinicians and treat their patients in the best environment, but also kind of to try to create an environment where that promotes people wanting to be more and do more, not only for themselves, but for their patients. And so making further education accessible to them is huge. And so that's what we've really tried to do here. I'm also over the therapy that happens in the main hospital. So we have a total of another 24 therapists over there between OT, PT, and speech that provides therapy 7 days a week. And so what we've really tried to create here at DHR is that through all our service lines, when they come in through the ER, through the main hospital, into rehab, and off to our 2 outpatient clinics, we want to really promote that fluid, continuous, end-to-end care, so patients can reach the full capacity of their goals and their rehabilitation. And so that's a big thing to what we do here as well. I'm not sure how many people are interested in being therapists, but it's a very rewarding profession. So is nursing, so is physician. Yeah,
Can you tell us more about the robotics that is used in physical therapy? Because most students have interests that they may be interested in health science, but they have other interests as well. So it would be good if they can see the combination of multiple interests in one profession.
Sure. So another important thing that has a very big tie into rehabilitation is there's a degree out there for biomedical engineering. Huge developing field if you like math and the computers and things of that nature. And so I'm interacting more with those individuals. I actually had a meeting today with a professor, Dr. Baker from the University of UTRGV today to further research aspirations. And so, so bioengineering is a huge field that you might want to consider as well. Strong in computers, strong in engineering. And so those individuals will team up, just like Dr. Baker's wanting to do with me, is team up with therapists and to take what's done in the clinic and put that into research. Oftentimes developing some sort of device or some sort of equipment. Things like nanotechnology is big, is up and coming. Robotics is up and coming. Virtual reality is up and coming. And then so that's another big field in reference to the medical field and bioengineering. The people that develop EXO, that is all centered around bioengineers, mostly coming out of Berkeley, California, or Berkeley University. So that's a field that you might want to be looking into. Another field that's very closely tied to therapy is also an orthotic or orthotist, prosthetist. And so these are the people that develop prosthetic limbs for patients. And so I don't know if you've seen patients that have had arm amputations, but before, back in the day, it was just a hook that was their option. And they would control that hook with their scapular muscles by either retracting their scapula or elevating or protracting their scapula. And it was just a hook. It was very functional. It got the job done. But now they're coming out with hands that articulate and oppose the fingers and can grab up to things that weigh 50 pounds. And so that's very exciting. So bioengineers are coming up with that technology, and the prosthetists are channeling that technology to be accessible to the patients. And so the prosthetist will take a mold of their arm and make it make it able to interface with the patient's body, and then they're very knowledgeable of the technology, and then they'll program the technology so it can do what the patient needs it to do. Same thing for the legs. We got prosthetic legs that cost upwards of about $60,000, $70,000 for patients that have had an amputation above the knee. And so that technology all goes into the knee component. We may take for granted what our knees do, but they do a lot. And so they're developing these computers that can essentially do what our knee does. And so in reference to, being able to go up a stair, it's all programmable into programming the amount of torque and tension in the knee so the patient doesn't buckle or fall down. They can do it once the prosthesis is fit to the patient's limb. They can program the knee component, the computer, with a laptop via Bluetooth while they're walking in the parallel bars. So it's a pretty exciting thing. Those type of patients I saw a lot of when I worked for the Center for the Intrepid in Houston, in San Antonio at Brooke Army Medical Center. So those were being used a lot with the soldiers coming back from Iraq and Afghanistan that had sustained an IED blast and had to have an amputation. So these are your 18, 19, 20-year-olds that they don't just want to walk, they want to run again. They want to go back to some of them went back full active duty with a prosthesis. And so their goals are different. Patients' goals are always going to be different. So as therapists, we have to be creative and have to be sensitive to make sure that we're not just making general goals, we're making it specific to what the patient needs. So my goals for them were to be able to run, be able to jump, you know, and things of that nature. So that was very, very fun, very exciting. There's also room for sports with wheelchairs. My father played wheelchair basketball. We don't have that here in the Valley yet. We're working on it, but we need to get a database to identify those individuals that are capable and interested in doing that. And so there's wheelchair basketball. There's rugby, wheelchair rugby, that's designed for quadriplegics, patients that have impairments of all four extremities. There's a movie out there called Murder Ball. You might want to check it out. It kind of explains about quad rugby, and the captain of the U.S. rugby team is out of San Marcos. His name's Mark Zupan. Met him, and these guys are very competitive individuals. Most spinal cord injuries are males. They're noticed to be risk takers. They're often, you know, racing their cars or jumping off cliffs or doing some sort of thrill-seeking activity that kind of leads them to a spinal cord injury. So oftentimes these people need to have, these patients need to have channels to be able to harness that drive for adrenaline that they always had. In wheelchair sports is that. And so if you haven't had an opportunity to get in a wheelchair, a sports wheelchair, and try wheelchair basketball or rugby, it's pretty hard. I remember when I was in San Antonio, I was helping with the wheelchair basketball team, and their competitive men's wheelchair basketball team one time had an exhibition match with the Spurs, and the Spurs could not beat them. I mean, because you're in a wheelchair and you obviously can't use your legs, and the wheelchairs, they have no brakes on it, so you have to stop it with grabbing the rim real hard. And these spinal cord injury patients that are used to using these chairs were very aggressive and ruthless with these Spurs, even though they were NBA pro players, but they didn't hold anything back with the Spurs, because just like when you're playing basketball and you're kind of going for the ball, you might get an elbow or something like that. You're taking a risk of getting a foul. Same thing happens in wheelchair sports, except they're trying to flip you over in your wheelchair. So they did that to David Robinson. They flipped him over in his wheelchair. So it was pretty interesting. That tells you how long ago that was. David Robinson was still playing, but they're very competitive, and so it's fun. It's fun to be able to give them that possibility. And there's therapists that's what they specialize in, is just wheelchair sports and helping those type of patients. Another big field that most students that are going into therapy, most of them want to do sports injuries for high school teams or college teams or pro athlete teams. Becoming a pro team physical therapist is about as competitive as somebody becoming a pro athlete. It's pretty competitive. But one of my professors at the University of Texas Health Science Center, her name's Catherine Ortega. She was the head physical therapist for the female Olympic team. And so she's originally from San Antonio. She's Hispanic, which is rare that it's a female doing sports, and it's rare that it was Hispanic. And so she's awesome. But she had a lot of contacts with being into pro competitive sports therapy. And so two of my classmates, when it was time to do clinical rotations, you do clinical rotations in several settings. Usually it has to be one in the acute setting, one in rehab, and one in outpatient. And then we had an elective, which was a 4-week. So two of my classmates got to do their rotations with pro teams. One did their clinical, their elective 4-week clinical rotation with an England pro rugby team. So he had to go to England. He afforded the expense. And then the other one went to Spain and was with Real Madrid pro soccer team, which was a huge thing that everybody was jealous of. but it was a big opportunity for him to help the physical therapist with the Real Madrid soccer club. And so that's another opportunity for physical therapists to get involved in. They're extremely rare, but it's not to say that with the right work and preparation and ambition that you could achieve that as well. But that's another aspect to therapy that we can do. With EXO specifically, we are really getting prepared to start research with EXO here. We have been collecting data, and so we're really getting prepared with that. I have a meeting with Dr. Baker, like I mentioned earlier today, from UTRGV to see how we can collaborate to do that. So we're really looking forward to that as well.
I think that's great. We're coming to the end of our time. I want to thank you, Mr. Auer, for sharing your experience and your advice. As always, I want to tell students that you're more than welcome to contact either ourselves or Doctors Hospital at Renaissance if you want any further information. That's all for today. We look forward to seeing you again next month. Have a great month. Bye.
All righty. Bye-bye.